What if one of healthcare's biggest AI opportunities isn't replacing doctors or getting rid of the paperwork that's eating up their time? That's the problem Abridge is trying to solve, and investors are putting hundreds of millions of dollars behind it. Abridge was founded in 2018 by practicing cardiologist Dr. Shiv Rao. The idea addresses a frustrating part of a clinician's job. After seeing patients, clinicians have to document those visits and create detailed medical records. Abridge uses AI to tackle that workload. Instead of the clinician having to manually recreate everything afterward, Abridge records conversations between clinicians and patients. Its AI can then summarize those conversations and help fill out electronic health form. And this isn't just an experimental technology being used by a handful of people. According to the article, thousands of clinicians are already using Abridge, a health system, including Johns Hopkins Medicine and Mayo Clinic, and that's where the money gets interesting. In June 2025, Abridge announced a massive $300 million Series E funding round, supported by Andreessen, Horowitz, and Khosla Ventures, that brought the company's total funding to a reported $830 million, and its valuation, $5.3 billion. Think about that. A company built around reducing the paperwork clinicians deal with after seeing patients is now valued in the billions. And that tells us something about where investors believe AI could create enormous value. The headline-grabbing AI stories often focus on robots replacing workers or AI systems doing jobs completely on their own. Abridge represents a different possibility. AI doesn't necessarily have to replace the highly skilled professional. It can take a repetitive, time-consuming part of that professional's job and make it dramatically easier. For clinicians, that could mean spending less time documenting what happened and more time focusing on their patients. And for investors, that creates an interesting proposition. If a technology can solve a problem experienced repeatedly by thousands or potentially far more healthcare professionals, solving even one piece of that workflow can become an enormous business. That's why Adrian is a company worth watching. Not because AI is suddenly becoming the doctor, but because AI may be becoming something much more immediately useful, the tool that handles some of the work doctors would rather not spend their time doing. And investors are betting hundreds of millions of dollars that this idea has a very big future. Like and subscribe for more.